and how you apply that knowledge in a given scenario or situation. Okay, so in part 3, basically station wise, if we see, so there are total 14 stations. That include patient simulated tasks, colleague tasks in which you may have a teaching station with your junior colleague, or you may have a structured discussion with your examiner. And in some station, you may find a lay examiner. Okay. Domain-wise, the entire MRCOG Part 3 exam, basically they rotate around these 5 domains that include patient safety, communication with the patients and relatives, how you communicate with your colleague, information gathering, and applied critical knowledge. So it's very important that it should be known that what is being tested in each domain. Okay. So in patient safety, basically you have to check the identity, you maintain the confidentiality if it is necessary, because in some scenario you need to maintain the confidentiality, and after that the patient will open up to you. It's very important once you're going for the examinations, it should be in the presence of chaperone. Okay, and you also respect the patient beliefs if the patient is Jehovah's Witness. So it's very important that in certain situation, like if a case of placenta previa, in which you anticipate that there may be loss of maybe lots of bleeding loss, and maybe the life of the woman may be at risk. So in such kind of situation, you can ask to the Jehovah's Witness that whether they have signed the advance directive or not. Advance directive is such kind of a document, written document, in which the patient gives the consent, whether in such kind of critical situation, whether they need blood transfusion or they avoid it. Similarly, you know your limitation. It's very important because in UK system, they have a very organized system in which there is a foundation year people, then senior house officer, then ST1 trainee, ST2, so registrar trainee, and then consultant comes. So it's very important because in our home country, we are doing everything by ourselves. So it's very important that we should know our limitation and where it is necessary to involve your senior, and when it is important to involve your consultant. So it's very important. What are the limitation of yours? Very important that you should explain what are the red flag sign of the patient and when the patient comes back to you. And in a surgical core surgical module, if the patient is going for any surgery. Hello. Yeah. Yeah, session is started, and have you started the recording, Simon?
Yes, I have started.
Yeah. Okay. So before going for any surgery, it's very important that you have to exclude the pregnancy. This is also a patient safety. And once a patient is going for a surgical case, so it's very important that we have to follow the WHO surgical safety checklist. It's also come in the patient safety domain. So what comes in the communication with the patient and relatives is very important. And after introduction, it's very important how you break the ice. Means that you should know about the patient concerns and what the patient is expected from today's meeting. Make a good rapport. Body language is very important. You have to have eye-to-eye contact, and you have to give a very attentive listening gesture to the role player by giving a head nodding sign. Okay, always recognize how the patient feels at the moment, and show your empathy if it is necessary, appropriately, particularly related to that situation. Give your information in chunks, and it's very important that in between you check the patient understanding by asking that, okay, are you with me? Is there anything which you like to repeat? Okay, be honest to the patient. Don't give her any false, reassurance. In right questions, you can ask, you can tell to the patient that, do you want to ask any question up till now? And whatever the decision is being making, it should be shared and mutually agreed. And it's very important that in between you can use appropriate connectors. If the patient say that it's happened to me and all these things, so you can say that, oh, I can see that, I know this must be a difficult situation for you. And it's very important that once you inquire about a sexual history or anything, so it's very important that you always signpost. Okay. Then communication with the colleague, it's very important that this is the colleague which is easy to pass as well as which easy to fail, because only one line needs to be speak up during the station that, okay, I will involve these expertise. I will discuss this case my consultant. So this is easy to pass, and sometimes if you forget to tell these things, so this domain can easy to fail as well. So you should have an MDT approach where appropriate. And SPAR tool is this tool is being utilized once you are communicate with your senior consultant regarding any case discussion, or if you are giving any handover to your colleagues. So it's very important that how you communicate. So it should be in a SBAR tool, which is a situation, background, aware, assessment, and the recommendation. In teaching station, you will encounter with your junior colleague who want to learn something by you. So it should be very friendly, non-judgmental, and you cannot undermine your colleague. And it's very important that in between you have to some kind of reassure your colleague and appreciate your colleague. In a structured discussion, it's a formal thing. Structured discussion with your examiner. Then applied clinical knowledge. It's very important that you have. I know that you all people have a very good knowledge because all you have passed your part two exam. So how you apply in the given scenario, like how they just want to know that how you clinically interpret it, if the results it's being given, how you offer the evidence-based treatment according to the guideline, and if you are giving any options to your patient, so how you discuss these options in terms of their risk and benefit, and let the patient decide. Okay. And always, whatever the investigation and management plan is being given to your patient, so you always justify that thing. So that's how your applied care knowledge being marked. Information gathering. Information gathering is very important, but the main thing is that how you gather all the information. It's very important that you have to take a very relevant and focused history, in spite of taking the full detail format you just trying to get from the patient. Modify your template accordingly, and it's a good thing that always start with an open-ended question. May I know about your pregnancy? How it is going so far? Okay, be logical and organized, and try to complete your history within first 3 minutes maximum. Or in case of urogynecology station, sometimes the history may take longer, so it should not be more than 4 minutes. Okay, and after once you have completed your history, so if you have enough time, so you can summarize the history points. Otherwise, there's no need to summarize. Okay, depends on how you practice and how you frequently get all your information. Then you can summarize. Okay. Um, so whatever the stations it's being given to you, it's you will be provided 2 minutes to read the task. So these 2 minutes you have to be used very smartly. You have to read your scenario very carefully, and situation awareness is very important. Who you are and where you are, whether you are in an external emergency, whether you are in a ward, whether you are in a post-op recovery. So this situation awareness is very important. Okay. And you just check what are the tasks is being given to you and what are the domains needs to be tested. If the information gathering is there, so it means that you have to take a history. Otherwise, if there's no information gathering, so you don't need to waste your time by gathering all the information from the patient, because there's no mark for the information gathering. Just relevant thing you can ask if it is necessary related to that station. Otherwise, you can omit it, because most of the information is being already given. Okay. Patient safety and applied clinical knowledge, these are the two domains which is almost always present and always tested. So it's your habit. Like at the moment you are practicing with your colleagues, so it's your habit that how you utilize, how you manage these 2 minutes. If you have a habit to make down, to write down any information, important information like name or main complaint in a bullet format, so you can have your habit in your exam as well. Otherwise, if you don't have such kind of habit, you just keep in mind all these important informations in your mind. So that also good. So there's no hard and fast rule. It's all depend upon your practice. Okay. So the main important thing is you just memorize the name of the patient, because in the station you have to address your role player with the name. And if you forget the name, so one time it is acceptable. But if you repeatedly forget the name and you just repeatedly ask the name from the role player that, okay, I'm so sorry, I forget your name. So please, may I know your name? Again, I'm so sorry. So it will give a bad impression. So always these are the most important thing which need to be memorized. And the next thing is that if there are too many informations is being given and you are unable to read all the information within 2 minutes and your time is up and you just start your next 10 minutes for the performance. So it's very important that once you enter, so don't need to be panic. Once you enter, you introduce yourself and you just take the permission from the role player or your examiner, that you can say that, okay, let's suppose that the name of the patient is Sarah. So you can say that, Sarah, is it okay if I took few seconds to complete all the information which is being given, so I make sure that any important information I haven't missed. So that's how you can complete your information. Okay. So in 10 minutes time to complete the task of role play station, so it's very important that how you introduce yourself, you have to confirm the identity, you just confirm what's the purpose of the meeting, and then you have to set your agenda, take relevant history within 3 minutes, and you can ask the patient at the end that is there anything you want to add. Then if you have time, so you can summarize, otherwise there's no need. Body language and eye contact is very important. Be active listener. You have to respond accordingly. Offer examination if it is relevant. Otherwise, if the examination is already given, so there's no need to again do examination. You can see that I can see that you have already what the examination is being given. So according to this, you can say. So it depends. Once we do the practice session, so we will further elaborate these things, and negotiate a shared management plan in terms of their risk and benefit. And at the end of the station, how you close, you provide the patient information leaflet, you can provide the support group, and you can document all the things. You can write back to GP if the patient is being referred by your GP. Okay. In structured discussion, the introduction is totally different as compared to the role play station. This is a very formal kind of station in which once you enter, you can say that, okay, I'm Dr. Seema, one of the exam candidate. I have read the scenario. I'm ready for my structured discussion. So this is the introduction. Then you have to follow the provided instruction. Be focused, whatever the questions being asked by your examiner. So your answer should be very concise and to the point. Okay, so listen your question carefully and answer to the point in logical manner. So that's how you can impress your examiner and gain the confidence if all your information gathering and your communication doing smooth. And once the question is being asked about the management, so it's very important that you explain your management in a very logical sequence, that first line management is this, second line is this, third line is this. So according to the guideline, we have to offer the treatment. So, what are the tips to remember? It's very important that this is a very doable exam. Okay, if we pass, so it means that everyone will be passed. And the main thing is that you have to be remain calm and composed and be confident. Try to be polite always and don't panic. If odd stations are being coming, so remember this thing that if there's an odd station, so they will be odd for all of the candidates. So even if you feel that you don't know anything about the station, so you just follow the simple rule of that module and put in mind that the role player will hopefully give you some hint to guide you, because these role players are very cooperative. Believe me, they are very cooperative and they help you in passing you. Okay, so be calm and composed is the main thing in this exam. And during the station, if role players say that I am not happy with the treatment is being given to me, and your nurse is not competent, anything like that. So try to remember this thing that don't blame your colleague anyway. You can just acknowledge her concerns and show empathy and just say that, okay, we cannot exactly commit what actually has happened at that time, but I'm so sorry that your expectation is not up to the mark. So we definitely investigate and raise the incident reporting, and whatever will be the result, I will be open and honest to you. So the main thing is that don't blame your colleague. You can say that everyone is working in the NHS. They are very experienced and they sign off of their duties. So that's how, don't blame your colleague. Okay. If you start your station in a right direction, so then this will give you a confidence and impress your role player and examiner, and hopefully you will pass. So it is rightly said by the Napoleon Hill that it is literally true that you can succeed fast and quickest by helping others to succeed. And this is the main aim of starting this group, to help you out for the upcoming exam and make you succeed for your MRCOG journey. Okay, so now I'm going to start the practice session. Okay, I'm changing my slide. Anyone who wants to do the station?
Can I do, ma'am? Shaista.
Shaista, you want to do? You are appearing in the exam?
Yes, ma'am.
Okay, good. So Shaista, I'm setting your 2 minutes time. Okay, read your station and then you have to perform in the next 10 minutes. Can you see the slide properly, na, Shaista?
Yes, ma'am.
Okay, now your time start now, and I'm showing this slide. This is the slide.
Can I start, ma'am?
Have you completed? Okay. Just wait. I'm just setting your 10 minutes time. Okay, start.
I am Dr. Shaista, one of the doctors in the early pregnancy assessment unit today. May I confirm your name and age, please?
Yes, I am Rebecca Smith. I am 30.
Rabika, I gather from your case note that you are 6 weeks pregnant and you have a spotting and you want to discuss your report. Am I right?
Yeah, doctor.
Yeah, sure. I will address all your concerns in a while. But before that, is it okay if I ask you a couple of questions to know more about you? So finally, we can lead to self-acceptable and mutually agreed management plan.
Yeah, doctor, but I'm very much anxious and worried because I'm having a similar kind of situation which I have experienced in my previous pregnancies. I'm just worried, though my ultrasound has been done, but I'm just worried what the ultrasound say. Is there anything bad with me or what happened?
Yeah, sure, Rabika. I can see you are worried. We are here to help you out and support you. Is it okay if I ask you a few questions before discussion of your report?
Okay.
Could you tell me more about your pregnancy? How has the pregnancy been so far?
Yeah, actually, doctor, I'm just happy once I got the confirmation of my pregnancy, and everything was going good. But since last 2 days, I have noticed that there's some spotting. Though I have no pain, but it's slightly discomfort. That's why I came in emergency because last time I have experienced similar kind of situation, and I have lost my pregnancy.
Mhm. So, do you have any vomiting or shoulder tickling along with this?
No.
Mm-hmm. So you started folic acid.
Yes.
Any other complaint apart from bleeding?
No.
How severe is the bleeding? How many pads do you use per day?
Doctor, it's just a spotting.
Mm-hmm. All right. When was your last menstrual period, Rabika?
Yeah, it's 6 weeks ago.
Otherwise, your periods are regular?
Yes.
Mm-hmm. Yeah, my questions might be interesting. Can I proceed?
Yeah.
So, any pain during the sex?
No.
Have you ever been or treated for sexually shared infections?
No.
Any vaginal discharge or pain anywhere
No.
else in the body?
No.
Uh-huh. So, Rabika, otherwise, are you up to date with your cervical screening? Were
Yes.
you on any contraceptives before this pregnancy?
No.
All right. So, could you tell me more about your previous pregnancies, Rabika?
Yeah, doctor. My first pregnancy was a toxic pregnancy, and it was an emergency situation. I just about to collapse, and I was bleeding at that time. And I came in emergency, and they have done a operation on me, and they told me that this was in my right tube, and they have removed my right tube. Next time I again conceived with this ectopic pregnancy, and it was at my left side. But they gave me certain kind of injection, and they have been treated. In my last pregnancy, it was inside my womb, but unfortunately, also missed this one.
So, how was management at that time, your last miscarriage, medically or surgically?
Yeah, it was done medically.
Any complication afterwards?
No.
All right, I'm so sorry. You're going through a lot. You had to help you out. Otherwise, are you fit and well?
Yeah.
Any surgery in your tummy or down below apart from the treatment of ectopic which you had?
No, that only.
Are you allergic to anything, Rabika?
No.
Do you smoke or drink alcohol?
Not really.
Are
No.
there any passing recreational drugs?
No.
Your blood group?
Yeah. O positive.
Any reservations related to blood transfusion?
No.
Any family history of concern which you would like to mention?
No.
May I know your weight and hydration?
Yeah, it's 23.
All right. What do you do for a living?
Yeah, I'm a teacher.
And how is the support at home?
The support is good.
Good to know that. Have you ever felt down, depressed, or hopeless in your last couple of weeks?
No.
Thank you very much for the information, Rabika. Would you like to add anything else?
No, that's all. I just want to know my result.
Okay, and this is our virtual meeting, so let me check if the findings are provided to me. Okay,
Hmm.
so Rabika, I can see your report are with me. I have confirmed your name, age, and your NHS number. This report belongs to you. I can see you are alone today. Would you like someone to be with you?
No, actually, my partner is outside, so I'm just alone. You can tell me, doctor.
All right, Rabika, I have a difficult news to discuss with you.
What happened, doctor?
Rabika, this time there is an other ectopic pregnancy, but this is on your left tube now.
Oh my God, doctor. Again, I'm having this ectopic pregnancy. I'm just hoping that this time I have a baby. I really want to have a baby.
You can understand.
I think, doctor, this is my fault. All the time this happening to me. It's mean that I may not be pregnant again. I can't have a baby anymore.
Radhika, don't blame yourself. It's not your fault. Sometimes there's no reason for the problems. Anyways, we will work together and I will let you know how it can be tackled. Um, can I continue the session? As a statement for you, and I'm so sorry to be the bearer of this news. So, Rabika, now come to the management options. You will be managed by a team of doctors, including my consultant, keyhole surgeon, scan doctor, and specialized midwife, specialized nurse. And we will keep your GP in the loop and support groups as well. Are you with me so far?
Yeah, I'm listening.
So, Rabika, there are a number of options for the treatment. We have wait and watch policy, we have medical treatment, and we have surgical treatment. Wait and watch policy is only suitable for patients who have no symptoms, and the beta ICD, the pregnancy hormone, is very less available in the same. More also visible in the same. Second option is also an option, but it is also not suitable in your case because heartbeat is visible. So the option which is left, that is surgical treatment. So are you with me so far?
Yeah, doctor. So it's mean that you are going to remove my left tube also. So how can I have a baby?
Yeah, Rabika, I can understand your concerns. At daytime, we will check at the time of surgery. There would be a keyhole surgery or open surgery, but I think you are stable, so keyhole surgery would be suitable for you. And at daytime, we will see what is the status of your tube, whether the affected tube is repairable or not. If your affected tube is repairable, then we will remove only the pregnancy tissue and we will repair the tube.
Mm-hmm.
Okay, so in this way, we can save your left tube, as your right tube is already removed. All right,
Yeah.
but it depends on the situation at daytime. I can't guarantee for that. All right,
Okay.
and after that, we will monitor you on weekly basis by your pregnancy test every week till it becomes normal. All right.
Mm-hmm.
But I'm afraid after this treatment, if this treatment is called salpingotomy,
Mm-hmm.
after this treatment, there is a chance of remaining of pregnancy tissue behind in 15 out of 100 cases. And in that case,
Mm-hmm.
again, there is a need of intervention, either in the form of surgery or in the form of medical treatment. Are you with me, so?
Yeah. Yeah. I'm with you.
And if we are going to remove your tube, for example, if it is already ruptured or we are not able to repair your tube, in that case, I'm so sorry, we will remove your left tube as well. Are you with me?
Okay.
Mhm.
Yeah. Yeah. So what will be my option of having a baby?
Yeah, Rabika, you can be pregnant even if you don't have both tubes. You can be have option of test tube baby, and there is also option of adoption. In test tube baby, we will refer you to the fertility specialist. We'll pick up your eggs and allow them to meet up with your partner's sperm. And once the pregnancy is established, we'll put inside the womb. And in this way,
Mm-hmm.
you can be pregnant. But again, I'm afraid in IVF, this is test tube baby, the risk of ectopic is still, which is 2 to 5 out of 100 women. Am I clear so far?
Okay.
Anything which you would like to me to repeat for you?
No, doctor.
So, what are your thoughts about admission?
Yeah, is it necessary to admit at the moment? I have to discuss with my partner and then I will come tomorrow. How this is it okay?
I can understand your concerns, Rabika. You can call your partner because this is an emergency. At any time, your tube can be ruptured. I'm here waiting for you, and you can call your partner, and we are here to take care of you.
Okay. Time up.
I
Time up.
have given,
Okay, close your station.
yeah. So I'm going to admit you, and meanwhile, you can read these information leaflets. These are number of support groups, and my consultant will be here in a bit, and we will take things forward from there. Thank you very much. I'm here to
Thank
take
you
care of
very
you.
much.
Thank you.
Okay. So, Shaista, well done. Shaista, so how do you reflect on your station?
Reflection. I think I am monotonous most of the time.
Mm-hmm.
This is my, I think, inbuilt nature. I can't be up and down.
Mm. Okay. Well, otherwise, you were good throughout the station. But one thing I noticed that you just entered your station with your set mind that you after introduction you have to set your agenda and in the agenda you just say that you have to take the information gathering and then you have to disclose the result. Okay, so this is most of the time this is the set agenda once we are preparing, but sometimes we need to modify our agenda setting according to the given scenario. As in the scenario you can see that this is a patient who have previous two ectopic and one miscarriage, and again this is a fourth pregnancy, and again the scan is being given to you and it shows that this is a ectopic pregnancy. So from the beginning, the role players show you her concerns regarding. I am assuming that something is going to be bad with me. I'm having a similar kind of situation which we have in our previous pregnancy. I just want to know my result. So it means that in spite of further increasing her anxiety, it's very important. Then and there, you have to break this news and then you proceed further. Okay, because because one time the role player prompt you once you set your agenda and you say, is it okay if I ask? So at the same time the role player told you that I'm just worried, doctor, I just want to know my result. I'm having a similar kind of symptoms which I have experienced in my previous pregnancy. So at this time, you just pick up this point and you see, you can say that, Rebecca, I can see that you are very much anxious. So I can see that you are alone. So would you like to have someone to be with you while discussing this report with you? So at the same time, you have to break this news because there's a recurrent pregnancy. You don't need to explain the diagnosis. You just break the news and give pause and see the patient response, show your empathy, and then you proceed further your questioning and your further management plan. Shaista,
Yes, you are very right, ma'am.
understood?
Yeah,
Understood
yeah.
now?
I
Yeah.
realize
So,
this point.
huh,
Yes.
so this is the main point. So in this way, your communication with the patient is going on the borderline side. Otherwise, on information gathering, your applied clinical knowledge, all these you are past in all these stations, and you try to manage your station within a time. You explain all the investigation with pros and cons, all the options you are giving very rightly. But this is the thing that in which you just lag behind. Okay.
Right, right.
So try to modify your template. Don't go with a set agenda and set template because you have to modify your thing.
Mhm.
Okay.
Yeah.
So in the information gathering, you are passed in this domain that you will take the focus history. You inquire about the pain, bleeding, shoulder tip pain. You inquire about the detail of the previous obstetrical history, and you inquire about the allergy, medical and surgical, BMI, smoking, blood group, reservation, contraception. You try to, because the rotor city, why this is happening all the time with me. So you just say, so at this time you can say one line. This one line is also missing. You can say, don't blame yourself, and this has happened. And those women who have a previous ectopic pregnancy, the chances of having a recurrent ectopic pregnancy is being increased. You can say like that also. So this one line is also missing. Okay, and very good. You signed posting this STI before starting this STI history. So you pass in this domain. Communication with the patient, your introduction is good. You check the identity, you make a repo. But again, this thing is that you have acknowledged that patient requires support, patient is anxious, so you have to break the bad news early, and then you have to take the information gathering. Meanwhile, I have no objection with your speaking, like you speak very calm manner, and you take the consent to proceed after breaking the news, and you give all the explanation in Chinese. You also check the patient understanding, and you avoid using medical jargons. You offer the pros and cons of each option. You provide the patient information leaflet. So this domain is goes borderline because of the early mistake. Hmm? Patient safety wise, it's also good. You offer all the evidence-based management, self-injecting, self-injectomy. In between, you answer like the patient say that it means that you are going to remove my left tube, so I cannot become pregnant again. So at the same time, you just inform that we will discuss later on, and there are option after removing all the both the tubes. Still, you have a chance to have a pregnancy by means of you can have your biological child by having option of IVF. So we'll discuss your case with the fertility specialist. Okay, Shaista, you told in between the station that even after that, still you have a recurrent pregnancy. Why you have a recurrent ectopic? Why? If both the tube is being missed and you directly insert the product of conception inside the uterus, so why this is ectopic pregnancy?
Ma'am, I told if you are conceiving with test tube baby IVF, in that case again there would be a risk of ectopic.
Why ectopic? Because both tubes are not there. You are directly inserted inside the uterus.
Yeah, I think this one is different.
This is some mistake. If in case of self-injectomy, there is a risk that the risk of recurrent pregnancy is being there because that tube is not healthy one. This is a damaged tube.
Yes, ma'am.
Okay, so in case of self-injectomy, there's a risk of future ectopic pregnancy. But in case of self-injectomy, both the tubes has been already removed, and we are giving option of IVF. So we are directly inserting the resultant product inside the uterus. So there's no risk of ectopic.
Yes, ma'am.
Okay.
Right.
Uh, Applied care knowledge is good. The good thing is that you told that why the surgical option suits best in her situation, because heartbeat is their beta CG level is on the higher side, so that's why these two options is not suitable for her. And with self-injectomy, what the options? If the tube is retained, we successful in retaining her tube, so it require follow up, and with beta SAG, and and there is a risk that if it is not falling down, still the pregnancy tissue is being there. So we have two options: either we give you the methotrexate, the medicine, or either we take you to the theater to remove that tube. So this is one of the option. And I have written just for your information that if we use methotrexate, so it's very important that we have to avoid alcohol intake and sun exposure, and use contraception for at least 3 months after the methotrexate usage. With self-injectomy, you rightly say that there's another option of adoption. So you involve the consultant, you offer the admission and blood test, so that is also a good thing. So the key point in this station is introduction, then address her concerns, relevant information, disclosure of the news by giving the warning shot. Empathization in this station is very important. Okay, and you can also offer her counselor support as well, because this patient is highly in a very upsetting mind. ठीक है, assistance of the patient. Okay, implantation, the justification of surgical option, invite questions, check understanding, recommend admission, blood sampling, involve colleague, including the anesthetist, consultant, and the fertility specialist, if the patient wants to know about the further future pregnancy option. Okay, so okay, Shaista, understood now everything?
Yeah. Thank you so much, ma'am. You gave me
Thank
the
you.
opportunity to talk. Thank you. So kind of you.
You have a very good preparation, and next time I just want you to pass this in one go. And if you have any query, Shaista, so you can post in our group, so we will help you out. Okay.
Sure, ma'am. Thank you. Jazakallah.
Okay. So now we are moving ahead with our next station, and Dr. Saima will take the second station. Saima, I'm stopping my sharing slide, so you can start your sharing slide. Okay.
Okay.
Saima,
Okay.
hello. Okay,
Hello. Can
Saima. So I'm stop sharing. Okay.
okay.
You can share your slide, Simon.
Before starting my case, I want to tell some points to previous presenter.
Yeah, sure.
Yes, ma'am.
Shaista. Okay, Shaista, some
Yes.
irrelevant details can be omitted from the history. In this way, you will save your time. Like you asked, are you taking folic acid? Because this patient was already diagnosed to be uh, ectopic. So, do you think is there any benefit in asking this?
Yeah.
Yes.
Right, ma'am.
Okay. And some lay language, some medical jargon you used, was your previous ectopic was treated medically or surgically? On the other hand, you can use lay language. You can ask, was it treated by giving some injections or by some operation, right?
Right, ma'am.
Okay. And then one more point which I noted that you offered her keyhole surgery, but it is important that whatever you offer to the patient, tell the risks and benefits. Like keyhole surgery, there are certain risks. Like most of the women are able to undergo this procedure without any complications, but some women can have some bleeding, infection. But most of the women recover very early. So few points you tell about laparoscopic surgery.
Right, ma'am.
Okay. Otherwise, you performed very well. Okay. So,
Thank you, ma'am.
can you see my screen?
Hmm?
Is my screen visible?
Yes.
Yeah. Your screen is
Okay.
visible.
So,
You can do a slide show, no? So it will be enlarged.
okay. Okay. So who wants to perform next station?
Yes, I want to do.
Okay. What's your name?
Bushra.
Okay, Bushra. Bushra, are you going to appear in the upcoming exam?
Yes.
Okay, good. So this is our second station. So we have limited time. That's why I'm starting. Your 2 minutes.
Okay.
Okay. You have one more slide.
Okay. Next.
Okay, can we start? Bushra, are you ready?
Yes.
Okay, start, please.
Hello. I'm Dr. Bushra, one of the doctors here in the ward. Is this Andy Jones?
Yes, doctor.
Okay. May I check your age, please?
I'm 20 years old.
Okay. So, Andy, I can see from your notes that you had an operation mm, yesterday, and now you are here to your discharge has been planned. So, I'm here to discuss about the procedure and your further follow up and discharge plan. Uh, so, is it okay?
Okay.
So before we plan your discharge, Andy, I need to ask you a few questions. So can I go ahead?
Yes, doctor.
Okay. So Andy, how are you feeling now?
Yes, doctor. I'm very upset because me and my partner John were very happy and we conceived after a long time. So after
Okay.
ending this pregnancy, I'm very upset.
Oh, Andy, I'm really sorry for you that you have gone through this traumatic experience. If you want, I can arrange a counselor for you. That will be of great help. What do you think?
Okay, doctor.
Okay. So any problem with your water works?
No, doctor.
Any bowel problem?
No, doctor.
Okay. And how's the bleeding?
I just have some spotting.
Okay. And are you eating well?
Yes, doctor.
And what about pain?
I don't have any pain now, doctor.
Okay, that's good. And I'm really sorry to make you recall the events, Andy, but could you please recall the events, at how it started and what happened?
Yes, doctor. I was 8 weeks into my pregnancy and everything was okay. I just had some excessive vomiting. I was taking folic acid, but just one day I started spotting. I went to the doctor and they advised an ultrasound, and I was very shocking to know that it is some abnormal pregnancy. And the doctor advised that we need to end this pregnancy.
Yes, I'm really sorry for this all, Andy. So, anything else you want to share with me regarding this pregnancy? Any other complaint you had at that time?
No, doctor.
Okay. And any medical problem you have, Andy?
No, doctor. Otherwise, I'm fit and healthy.
Okay. And any previous pregnancies?
No, doctor. It is my first pregnancy.
Okay. And what are your future plans for more children?
Yes, doctor, I am hoping for the next pregnancies also.
Okay. So, Andy, I can see from your notes that you are allergic to some medicine. So, I will document that in your discharge slip also. And apart from that, may I know your blood group?
It is O negative.
Okay. So, Andy, what's your weight to height ratio?
It is 22.
Okay. So, Andy, thank you for sharing all this information. So now coming to the other plan we have for you, so that uh, it's very important to have a proper follow up after this. Sometimes the remaining tissue grows inside the womb, and this can spread into the womb and can result in a serious form. We call it as which is can develop into the normal molar pregnancy, that is the cancer. So we have to keep you, we have to monitor you closely, and it's very important
So,
to
doctor,
follow you up through the pregnancy hormones.
can I
So
develop
this,
cancer, you mean?
yeah, no, Andy, and your ultrasound findings, you were having the molar pregnancy. So the tissue was taken, and this tissue has been sent for testing in the laboratory, right? And once it is confirmed that it is a molar pregnancy, then we have to follow you closely, because sometimes and can develop into the one in seven women. So therefore, we will monitor you closely and register you in a gestation trophoblastic disease center, the one which is nearest to you, and we will follow you up. They will follow you up through testing of your pregnancy hormones. So it will be done in the blood, that you can give sample at your GP surgery, or it can be done through a urine sample. They will send you the urine kits, and it is very important. If the hormone level is falling, then your follow up will be for 6 months from the day of your surgery. But if it's not falling, then the follow up will be prolonged. Okay, am I clear so far?
Yes, doctor.
And regarding your future pregnancy, it's very important that you use an effective contraception. So I will refer you to the contraception clinic, and you can use any kind of contraceptives except the coil or a coil inside the womb, because at this time your womb is soft and it can cause perforation of the womb, and you will take effective contraception till your follow up is complete. Okay.
Okay, doctor.
So am I clear so far, Andy?
Yes,
I
doctor.
know I'm giving you a lot of information. At the end, I will also give you written information material about what to expect at recovery and during follow up. And if your level doesn't fall, or if you have heavy bleeding, or have severe pain in your tummy, or foul discharge, I will also give you 24-hour emergency contact number. And if or your level pregnancy hormone levels plateaus, then you might need another form of treatment. We call it chemotherapy. Do you want me to discuss that?
Okay, doctor. What is it?
It is actually the medicine which we give through the drip in the arm, and it kills the abnormal cells in the body, and it is very effective, and almost 100% cure rate is there with this treatment.
Okay.
Okay, so any questions so far, Andy?
So, doctor, can I conceive a new baby?
Yes, sure, Andy. As I told you, once your follow-up is complete, you can conceive, and there will be no problem in having a future baby. And if you didn't receive chemotherapy, then there is no need of doing any test after your future pregnancy, and it's unlikely that it will affect your future pregnancy or fertility, right?
Okay.
And as Andy, your blood group is A negative, so we will also give you an injection. We call it NTD injection to neutralize the proteins, and this will avoid the formation of abnormal proteins in your body to avoid any complications in your future births and pregnancies and save your future children. Okay.
Okay. So, doctor, can I have this smaller pregnancy next time?
There is a very small chance that you can have it again. Once you are pregnant, so you will be booked in a consultant-led unit, and we will do an ultrasound scan to see if everything is well. Okay.
Okay.
So now I will complete your discharge report, and I will document the whole procedure. I will document the findings which were seen during the operation, and you will come back once.
Okay. So, can you see my screen?
Yes.
Sama, record the feedback as well.
Okay, recording is in progress. Right.
Okay. Good.
So, communication wise, I felt you are very polite, and your introduction was good, but you mix the aim as well as agenda, because aim of consultation and agenda, these are two different things. And in your consultation, you joined both of them, and then you started your consultation. And
Okay.
otherwise, you had empathy wise it was good, and you tried to avoid lay language, but at one point you used the word that this copper coil can cause perforation in the uterus. So instead of using perforation, you can say it can cause hole in the womb. Am I clear, Bushra?
Okay. Yes. Yes.
Okay. So otherwise you gave the information in chunks, and your language was very clear and understandable, and you invited questions, and you offered her patient information leaflet, as well as you offered her support groups and counselors, and you also write back to GP. Otherwise communication was good. Okay. So
Okay.
when you started your in the information gathering, right? So information gathering, you asked about BMI, it was good. You asked about medical history, because most of the information was already there. So it is good that you omitted most of the history, but there were some relevant things, because this station is about to give her contraception. So you can ask her, has she previously used any type of contraception, or has she any concerns about any contraception, or you can also rule out medical contraindications of contraceptives.
बुरा नहीं है मैंने मंगाया है तो अच्छा तुम्हारा वाला please mute yourself, Usha. Please mute yourself and stop your video.
Okay. So am I clear, Bushra?
Yes.
Okay. So you can just say, have you used any contraception previously, or do you have any concerns about any contraception? And then in the medical history, you can rule out any history of clots, diabetes, hypertension, or family history of clots, just because we have to offer her contraception to rule out contraindications.
Yeah. Okay.
Okay. And then when you started to give her information, you first explore her own knowledge about modern pregnancy. So you can ask her, Andy, do you know what is modern pregnancy? And just give some explanation. It is a pregnancy in which sperm has met with the empty egg. That's why it was abnormal pregnancy from the very start, and it cannot give rise to a healthy baby. That's why we have ended it. right?
Okay.
Okay. In the information gathering, you asked about blood group, but it was already mentioned in the case notes. So it is always better
Yes.
to ask any information which is already written. You can confirm the findings. You can ask in the way, I can see from your notes that your blood group is O negative. So have you received injection anti-D? You can ask in this manner, because when you will ask the blood group again, the examiner will have an impression that you have not read the task.
Okay.
Okay. So, when you explain the condition that we need follow up, you use the word that some of the tissue may be left and it can grow. Instead of saying the remaining tissue, you can say some abnormal cells may grow, and I'm afraid to tell you that they might give rise to some sinister changes. I don't want to scare you, but in case of complete mole, its chance is just 1 out of 7, whereas in case of partial mole, the chances of having this type of changes can be only 1 to 2%. And even these
Okay.
sinister changes occur, the success rate of treatment is very high and it has 100% cure rate. So when you tell the patient about the risk of developing sinister, at the same time reassure the patient that we will be following you by the beta HCG, and in case any problem occur, the success rate of treatment in the form of chemo is very high, so that patient will not get panic.
Yeah, reassuring
Yes,
at the
reassure at the same
same
time.
time. Okay.
Okay. So this patient in the history, it was showing ultrasound was showing that it is a complete mole, but it is not confirmed until we do a histopathology. On the histopathology, it could be a partial mole or it could be complete mole. So we need to tell the follow up of both partial as well as complete mole. Okay.
Right.
So you told the
Okay.
follow up about complete mole, and what about partial mole? We will say that the partial mole, in case it is partial mole, your follow up will be until your two levels of pregnancy hormones become normal 4 weeks apart. Am I clear, Bushra?
Okay.
Okay.
Yeah.
Okay. So then you told about gestational neoplasia and chemotherapy, right? And contraception, you told about complete and partial mole. In case she need further treatment in form of contraception, in further treatment in form of chemotherapy, then her follow-up will be 1 year, and she can't conceive 1 year till her treatment has completed.
Yeah.
Okay, right.
Yes.
And you rightly said that the future pregnancy, the risk of having molar is very less. In the other words, you can say that 99 out of 100 women don't have a molar pregnancy next time. In this way, patient will be very reassured that her chances of having normal pregnancy are more.
Okay.
Okay, right. And then you advised her early booking in the next pregnancy. Very right. Okay. So, otherwise, you offer her registration at the Trophoblastic Center. You can also say that there are 3 centers, one in the London, one in the Dundee, and Shepherd. And in communication of colleague before discharging this patient, it is important to involve consultant also. It will come under domain of communication with colleagues.
Okay.
Okay. Then you documented all things and you offered her discharge letter, right? And one important thing I want to tell about contraception is that as this patient has undergone suction evacuation 1 day back, so if we start contraception within 5 days of abortion or miscarriage, then there is no need of additional protection. On the other hand, if it is started after 5 days, then she will have to use either some barrier method or abstinence for 1 week.
Yeah. Right.
Right. This is important, otherwise patient may think that she can use contraception after some time.
Okay, thank
So
you.
most of the points you covered. I have just emphasized on the points you can improve upon. Otherwise, your performance is good, and just by practicing this station few times with your study partner, you will be able to do this very well.
Yeah, thank you.
Thank you. Okay. Thank you. So, any question?
No.
Okay. So, how was today's session? Is it informative?
Saima, I just want to say one thing to Bushra, that as I told in the beginning, that it's very important to read the task carefully.
Yes.
Okay, where you are, situation awareness is very important, because the first 2-3 minutes is going to pass you or is going to fail you.
Yes,
Okay,
right.
so first 2-3 minutes is very important to mark your impression to the role player. Okay, so everything is given in the scenario that this is a primary gravida and blood group, allergy, all the thing is being given. What the thing is not given, you have to pick up those and ask those questions particularly.
Yes, right.
Okay, so Bushra, this is the main thing. So do practice with your colleagues and utilize these 2 minutes very carefully. Okay, if you read these questions, these scenario very carefully, so you cannot ask any irrelevant question. And in the beginning, you ask that, okay, have you been pregnant before? It means that examiner and the role player can guess that you are not up to the mark. You haven't read the scenario carefully, and at the same time, you in the beginning you inquire about okay, what are your future pregnancy wishes, and your what you want. So these things is not appropriate at this point of time. Okay, so try to read your question carefully and try to take relevant history. Otherwise, your applied clinical knowledge is good. There's no problem, and your tone is very good throughout the station. You have a very polite kind of tone, so it's very good in dealing such kind of station in which we are going to give the breaking bad news. So try to improve this thing. Okay. Still, we have 2-3 weeks now for the upcoming exam.
Yes, situation awareness is something like I struggle
it's
with.
very
That
important.
is my problem.
It's very important. It will be no problem if you do practice more and more. So try to practice at least 5-6 station on daily basis. But now, as the exam is around the corner, so you have to do one session, like 10 station per day. So that's how you just tone up yourself.
Yeah,
Okay.
thank you.
Yes, Simon.
Okay, so I was asking about feedback from my candidates. How was today's session, and do you want more sessions?
Saima, one thing I would hear from you, that you told me that we reassure the patient that 99% there is a chance of healthy pregnancy. So recurrence is 1 in 80. So we say that 99% of chances for healthy pregnancy.
Yes, it is clearly written in the patient information leaflet that 99
Okay.
out of 100 will not have a molar pregnancy.
Okay. Thank you.
Okay.
Just I want to confirm. Okay.
Yes. Thank you.
So thank you everyone for joining our session, and those who are appearing in the exam. This is a chance to further enhance and further polish their practice. So we are also planning to do more practice session in upcoming week. So stay tuned up in our group, and we will shortly post it our next schedule of practice station to be done. Okay, and if people have any query, so you can post it in our group. Okay, so we will try to answer then and there. Okay.
And also, if you can do for us the daily task practice in your group.
Yeah, we also starting. So you people want to that from the book?
Yeah, doctor.
Okay, so we trying to start because we have in a plan from the next week, so we can start. You can send your audio and we will give you the feedback. Okay.
Thank you, doctor.
Okay. So Simon, so it's time to end our session.
Yes.
What do you say?
Yes.
Okay. So thank you again for all of you to join the session, and keep your if you have any queries, so keep posted in our group. Okay. So thank you for joining once again.
Thank you.